Kidney function is really important to know at many different stages of your life for several reasons. The first is that having kidney diseases actually increases your risk of many other types of complications in life, including things like heart attack and including complications from COVID-19 infection. The second is kidney disease can often be asymptomatic and really sneak up on you. So in order to know that your kidneys are not working as a good filter as they should, you often have to get a blood test or really look. And then the third is many of the medications that we take, many of the supplements that we take, a lot of those are filtered by the kidneys. We're learning more and more about which people are high risk from COVID-19. And one of the people that I would be more concerned about as a physician is the people who have kidney disease, because if your kidneys are starting off not being normal, being abnormal up here, it can take very little to tip you over. And we do know that those people that get very, very sick with COVID-19 do develop problems with their kidneys, can end up on dialysis, and that can be one of the complications that can, really lead to people not doing well, having prolonged hospitalizations, and in the worst case scenario, even dying. The main factor in the blood chemistry that tells you about kidney function is a factor called the creatinine. Now, creatinine is a product of muscle breakdown that exists in your blood, and we really look at that as a marker of the filtering capacity of the kidney. So if the creatinine is high, that means the kidneys are not filtering it out as they should. And if the creatinine is nice and low, that means the kidneys are working as a very efficient filter. So, if you have diabetes, you have high blood pressure, you're overweight, all of those are risk factors for developing kidney disease. And if you have not yet developed kidney disease, it doesn't mean you're out of the woods, because it's a really time dependent thing. So the longer you have those risk factors, the more the likelihood that you would develop kidney disease. So it's really important to initiate those lifestyle changes early, and lifestyle changes that can really help you kind of reverse some of those processes. So with respect to hypertension, it's really watching the salt in your diet and keeping your salt intake less than 1,500 milligrams a day. With respect to diabetes, you want to make sure you really cut down your carbohydrates, increase your level of activity. And then finally, if you're overweight, you really need to work on losing weight and exercising and being active. So really all the same things that we know we should be doing are really one way to optimize our kidney health.